Welcome to the official podcast of Aging in the Time of COVID-19, Reflections on Life, Health, Family, Community, and Purpose, with Ken Dychtwald, founder and CEO of Age Wave, and Peter Kaldis, president and CEO of ASA, from April 28th, 2020, part of the Future Proof series.
We have two distinguished presenters here with us this morning. Peter Kaldis is the new CEO of the American Society on Aging, and he's joining us from the South Florida Institute on Aging, where he led the advocate for improving socioeconomic services for older adults in South Florida. Peter was also a senior executive in J.P. Morgan Chase's Office of Corporate Responsibility and Foundation, managing philanthropic programs to increase economic opportunity in cities around the world. And our very special guest this morning is a man I've had the pleasure of working with at several of the Aging in America conferences, at our keynote events. Ken Dychtwald is here with us. Over the past 40 years, Dr. Ken Dychtwald has emerged as North America's foremost visionary and original thinker regarding the lifestyle, marketing, healthcare, and workforce implications of the age wave. He's a psychologist, gerontologist, and best-selling author of 17 books on aging-related issues, including Age Wave and A New Purpose. His new book, coming out in July, is What Retirees Want, a holistic view of life's third age. Since 1986, Ken has been the founding CEO of Age Wave, and his client list has included over half of the Fortune 500. He has served as a fellow for the World Economic Forum and was a featured speaker at 2 White House conferences on aging. American Demographics honored Ken as the single most influential marketer to baby boomers over the past quarter century. During his career, Ken has been a great friend to ASA and served on the board for many years. He's also a 2-time recipient of the ASA Award for Outstanding National Leadership, and we're delighted to have him here with us today. And at this point, I'd like to turn the floor over to Peter Kaldis and Ken Dychtwald. Welcome.
Thanks.
Thank you, Steve. Hello and welcome to Future Proof. I'm Peter Kaldis, the American Society on Aging's new CEO. And I'd like to welcome you to the first in a series of live broadcasts on innovations in aging, in particular during these unprecedented times. If you're an ASA member, welcome. I want to thank you for joining us. If you're not a member yet, I hope you consider joining a robust and diverse field of professionals who ASA has been empowering for 66 years. As a member, you'll get access not just to thoughtful and practical content and education, but also access to some of our country's top thinkers and doers. Future Proof is a perfect example of such a benefit, and I can't imagine a better thinker and doer to kick off our series today than Ken Dychtwald. Ken, welcome to the inaugural broadcast of Future Proof.
It's great to be with you, Peter. Boy, when we first met a few weeks ago on the phone and we were having a wild discussion, and you said, hey, how'd you like to do something like this in a webcast? I thought, well, okay. But who would have imagined we'd have 2,589 people sign up? We thought we might have 50. So welcome, everybody who's taken the time to be with us today.
Ken, it's true. We're just delighted that everyone is joining us today. There is obviously a pandemic going on right now, and I really want us to have a conversation today about how people are reacting to it and your thoughts about it. So first of all, how do you feel about sheltering in place?
Well, to be honest with you, I'm preferring to think about this not as sheltering in place. I know we had a bomb shelter in our house in Newark, New Jersey when I was a kid, and shelters were about fear. I'm preferring to think about this as cocooning, that just as a caterpillar takes some time to reconstruct itself, becomes a chrysalis, and then reemerges as a better version of itself. I don't know, maybe I'm a dreamer, but I'm thinking we're in this chrysalitic time right now, and I'm hoping that we can all come together and find a way to make a better world coming out of it.
So I understand that while you've been cocooning, it was also your birthday. So happy belated birthday, and I understand you turned 70. So tell me a little bit, how's it like celebrating your 70th birthday while sheltering in place?
Well, it was peculiar because the day before my birthday, I was supposed to be giving a general session at the ASA conference. I thought, boy, that'd be a great way to finish up my 7th decade of life. And then my wife and I were going to take a dreamy vacation off to the Caribbean and gather with our kids, and we were going to have parties. And instead, my wife and I cuddled up together that night all by ourselves in our home, and it was pretty great. But I'll tell you that really given me a lot of pause to think. And for my birthday occasion, we had my wife and I and our daughter, Casey, who's on this call, who's 33, and our son, Zach, who's 30. She's in L.A., he's in Brooklyn. He's been living in China, but he's in Brooklyn now. And my brother, and I asked for, rather than a big expensive gift or go out of your way, I said, I'd just like for each of you to tell me what was the best experience we ever had together. That would be my gift. And what was the best day of your life? And what everybody said to me in that call, I thought, wow, this is about the best birthday gift I could get. So I'm feeling, I felt sad going into the birthday, but then I felt, it's sort of like I've stripped everything away, can't travel, can't be on a plane, can't see all the people I care about, but I feel a lot of gratitude for these 70 years.
So as you reflect on 70 years, do you think aging has been, an ascent for you or a descent?
Oh, interesting question. I'd say physically, I'm trying to keep it from being a descent. I don't have the vitality I did when I was young. I've got an artificial shoulder. I've gained 40 pounds. I don't sleep as well. I've got high blood pressure and hypercholesterolemia. So as a guy that's been doing yoga and working out for 50 years, my body is not what it was when I was a kid. Also, I just haven't shaved for a few weeks. And last time I hadn't shaved, it was brown. So somehow it just came in white. I don't know how that happened, but something's changing in there, I guess. But I would say that emotionally, I feel like it's most definitely been an ascent. I feel that I have a greater sense of perspective than when I was younger. I feel more appreciative of people I love, and watching these nurses, watching these doctors, I just feel like, oh my goodness, to have an experience of people who are on the front lines. I have deeper appreciation for the greatness in so many people and for how hard we all try. And mentally, I think it's been an ascent. My friend Chip Conley refers to people becoming modern elders. And I like that idea. I like the idea that I've kind of earned this grayness and that I've learned more. I've not just been having birthdays. I've been circling the sun 70 times. And that's been quite a journey. And I'd like to feel that I don't want to be young. In fact, it'd be a hard time to be young right now in the world. But I'm quite, I feel good about my birthday. I feel good about my aging. But it's not all one thing.
So let's talk a little bit about what you don't feel good about when it comes to aging. What frightens you?
What frightens me? Oh, I think what frightens me is I've done a lot of therapy over the years. I watched my mom and dad die, my father-in-law die, my mother-in-law die, my stepdad is still alive, so I've been around death. I'm sort of okay with the end. I think there is another zone that one enters into. But I'm really frightened about suffering. I watched my dad go blind. I watched my mom have Alzheimer's for 12 years. I've seen people go mad in their later years. I've seen people put into institutions and treated in horrible, demeaning, degrading ways. So I'm not really keen on suffering. But I would say more than my own thing, people think about what they're frightened about aging. I'm far more frightened of something happening to my wife who's in the room, or to our kids, or to someone I care a great deal about. And I know that that's the territory of being older, that stuff happens to people. And I just don't know how much fortitude I've got to deal with more of those kinds of things. So we're all trying to shore ourselves up and turn those fears into action. How do I make the best of each moment? How do I live with a kind of an urgency and a presence? And how do I not let the fear overcome me?
Yeah, and Ken, I think a number of younger generations are equally scared and are sharing that fear right now, particularly given the pandemic. So I'm wondering, what do you see across the generations here? What are some differences on how the generations are handling this public health crisis?
Yeah, first let me say that I've been 4 years, so it's good to be back. And I had heard that there was this executive search going on, and that over 400 people were being considered, which was mind-boggling. And you were the chosen leader. And I don't know that you were picked because of your interview skills or because of your charm and playfulness and thoughtfulness, but I'm honored to be here with you today. I want you to know that. What a thrill it is for me. And so thank you for taking this time and asking me these questions. I think that it's very different for different generations. You know, over the last decade, our company, Age Wave, is doing massive studies all over the world. Young people, older people, middle-aged people, black, white, straight, gay, poor, rich, to try to figure out how people are contending with their lives, their future, their fears, their money, their health, their purpose. And here's just sort of a, first of all, everybody, it seems, got their own narrative going on about what's going on. And so mine is just like everybody else's. It's piece-parted from a little news and lots of conversations and lots of webcasts. But I think that older people are feeling very vulnerable because of the likelihood of lethality and contagion, and that's pretty damn scary. And because so many of our elders in this country are alone, live alone, and do not have a lot of interactivity, that's a very difficult combination. On the other hand, I also know that the average older person in America receives $18,000 a year from Social Security, which needs to be protected. The average couple, $31,000 a year. And the market value of a Medicare enrollment each year is $11,000. So for an older couple, that's about $50,000 safety net. And, you know, I had to pay attention to Bernie Sanders during his run. And he talked about how lots of people needed safety nets. And boy, when this virus came along and the tides dropped a bit, all of a sudden you saw jagged rocks pointing up in every direction. And so I think older people, and I would tell you that we do a lot of work with the Harris organization, and they do a Harris COVID-19 survey that's publicly available. Their studies are showing that retirees are the least distressed by what's taking place right now. It may be because they have some protection because they've got a financial safety net, or maybe they've got perspective, or maybe they're not in the process of getting fired, or maybe they're not in the process of being thrown out of their house as much as younger people. The older generation. In a moment, I'm going to come back and talk about there's a digital crisis going on relative to older people. I think that people 50 to 64 are getting the wind knocked out of them right now. These are the people that are all of a sudden saying, wow, I just lost a lot of my 401k. I was going to work a little bit longer. I don't know if there's going to be work. My kids have moved back home. My mom is sick. They're sandwiched in from every direction. So I think actually the pre-retirees versus the retirees are getting the wind kicked out of them right now. Then you've got people in their 30s and 40s who are right smack in the middle of, they've been dreaming their whole life of starting a company. Just blew up. They're worried about their mom. Now they can't see her. Their kids are freaking out because they can't play with their friends. They may not have any money. Their bill payments are high. They still got college debt. I think people in those 30s and 40s are hurting. I would have to tell you that I think that people in their teens and 20s, and I'm going to do one more, are having a formatively different experience. It's sort of like, wait a minute, what happened to my future? I was going to go to college. I was hoping to fall in love. I was hoping to have fun. Why is this happening? This is terrible. And I also think for a lot of young people, the traditional reliance on parents and grandparents to know the answers is broken right now, because most parents and grandparents don't know what's going on or when it's going to get better or who to trust. And so I think that's a brittle time to be a young person. And last, I'm most worried about children. There are many children in very nourishing, loving homes, but there's a lot of children in homes where the parents are fighting or where there's abuse going on and they don't have any outlets. And they are, being held captive in a situation that may take them years or decades to work their way out of. By the way, I want to tell you that coming out of all this, I think that what's really needed is a level of empathy we've never really thought about before. Older people are generally inclined to think about their own situation and their own families. This is more than that. This is empathy for people different than you. This is really stopping to think about what it would be like to have to lay off 27 workers that you single-handedly recruited. What would it be like to have your entrepreneurial dream destroyed? What would it be like to have your children bouncing off the walls? And I would argue that it's not just empathy for the different generations, but it's empathy for those who are not yet here. When we're older, we usually think in terms of our own time horizon. Oh, I want the world to be better while I'm here. We need to do a little more thinking about whether it's in terms of climate or health or economic equity or respect for differences, so that people who will be born in 20 years will have a great chance. So, yeah, I think there's generational differences. I may be wrong, but that's at least what I'll share.
Well, I'm wondering, Ken, given how valuable it is to have strong intergenerational relationships, I'm wondering if you have any thoughts on, what Gen Z could teach us during this disruption. What are some tips that you think they may have or we should be listening to from a younger generation about how to be resilient during this time?
All right, so I'm going to cross over here a little bit and be critical of the very field and population I've spent 45 years advocating for. I think that older people, let me flip it first. I think that we need to be sharing perspective. This is not a time to hunker down and say, oh, I got mine. We got to be our best selves. David Brooks, conservative writer for the New York Times, wrote a piece a couple of years ago where he talked about, you got two resumes working throughout your life. Your work resume, what's your title, what'd you do? I know you're a lawyer. I know that you work for JP Morgan. But then there's your eulogy resume, which is what are they going to say about you after you're gone? And if you don't like what that's going to sound like, then you better get on redoing yourself to be more of that. And I think as elders, we need to stand up tall and loving and be concerned for all the people in the world who are grappling with fear and loss and trauma and poverty and travesty and travesties in their community. So I think we can teach perspective, and we can be the elders. We can be the steadiers. Young people, their curiosity. If the elders of this country are limited in terms of curiosity. Before this pandemic, the average retiree watched 49 hours of television a week. We don't like to talk about that in the aging field. Only 23% of the elderly population in America volunteered before the pandemic. 75% did not. I think young people need to invite older people back into the game. They need to teach us about curiosity. They need to teach us why Billie Eilish is so popular, why Kanye West just became a billionaire. They need to teach us how their technology works. And that's really important. I'll tell you why. Because the silent generation, just older than the boomers, only 62% of them use the internet. And only 28% of them use any social media. So what we've created here is a lethal problem. We've got an elder population who now need to rely on digital technology for friendship, for nourishment, to calm them down, to share their wisdom, and even just as important, for their own actual health as we just become a telehealth world. The fact that our young people have not seen it as their role and responsibility to not just think it's fun that grandma, knows they're on TikTok, but actually teaches grandma how to set up Zoom calls. When I was a kid, my dad taught me how to ride a bike, and he taught me how to play catch. My kids, I know they're both on the call, they ought to be teaching my wife and I everything there is to be known about how to work digital health so that if we ever needed it, we could. So I think we've got a digital divide, and a lot of older people are in a digital ditch. I think young people can create the bridge for that. I think they can teach us curiosity. And also, as we know, that the young generations in America are far more likely to be diverse, far more likely to be multiracial, multi-ethnic, have different sexual choices, different views about religion. And so I would love to see the young generation teach the old generation to be less rigid. You talk about the need to bring generations together. Throughout the world, generations were always together. It's only in the last 60 years or so that we've broken them apart. And I think it's partly why America is broke right now. And we are broken. By the way, I'd say the whole world is broken. And that's a good time to not say, let's go back to how it was 3 months ago, but like a cocoon, How could we do a better job of being friends with the kids who live next door? How could we wave and smile at the elder who lives in the same apartment building? How can we make friends across the generations? I think those are the challenges of now.
So Ken, in the context of COVID, you raise a number of, real fissures that have opened up. Lack of technology, increased social isolation, a workforce that will be likely struggling. I'm wondering, what are some of the strengths and the weaknesses of the field in aging to be able to tackle some of these massive issues? What's your perspective on that?
Are you ready for the Dychtwald truth, even though it's obnoxious? What I believe, and I put 45 years in the field, so I feel like I've earned the right to share some of my concerns. First of all, this is a field that I think there's no more interesting field on this planet. The examination of what happens as we live longer lives, multiple generations, changes to work, changes to family, new needs in health. How do we match health span to lifespan, the possibility of wisdom in old age? This is the most interesting field there is. My sense of the aging field, the aging network, is that it's primarily driven by heartfulness. It rose up out of the civil rights movement. The people in the field are compassionate, they're kind, they're not in it for the money, they're in it for the doing good. Here's the problem. Two problems. One of the problems is they're very, it's not an innovative bunch. It's not a new idea gang. If you look at the conferences from the 1970s and the conferences from 5 years ago, they're almost identical. What's the other problem? It's fiefdoms. It's fiefdoms. I'm buddies with Fernando Torres-Gil, the former Undersecretary of Aging and future chairman of this organization. And Fernando's now in his early 70s and being a polio survivor. We were talking about how he lives in LA and he's got access to lots of programs, but he can't figure them out. There's thousands of them, and they don't talk to each other, and each one's got attitude. And we are not a user-friendly service field. You got aging this, you got home instead. By the way, I know we got people from housing and social services. Here's a good example. We've got the healthcare system, and we got social services. In the social services field, do not feel that they're a part of the healthcare system. Yes, you are. We have the world of science. And then we've got the world of caregiving. Well, if we had better science, we wouldn't have people with Alzheimer's, and so we wouldn't have so much demand on caregiving. The aging field has not integrated. It's a bowl of spaghetti and made worse for the people who are those who need it. And the most needy in our country are people over 75, women of color. If you look at poverty, if you look at vulnerability, if you look at need, that's the most needy segment of the population, and trying to access the aging and healthcare fields is almost impossible. I'll give you an example. So I've been on Medicare now for 5 years, and so I get a piece of paper each month. I should have brought it over here. It says on the top, "This is not a bill," and on the other side of the top it says, "This is your bill." Now, I'm a PhD. I've written 17 books. I've been in the aging field. I don't understand Medicare. I don't understand what they're talking about. And so how is the average person supposed to work their way through a system that's almost impossible to navigate? And I think this is a time for the aging network to say, okay, do we really need so many different organizations, or should we collaborate? Should we merge? Should we integrate so that for the user, so that for that person in the community, we can be easy to use and easy to work with. User friendliness is not the hallmark of our field. So more futuristic, more appreciative of science, and an integration of the entire field, which came up during the 20th century when there were different grants and different funding and different pieces, but we've allowed it to remain that way, and I think that's not good for the people.
Ken, reliance on science is something that has come up now a lot given where we are with the pandemic. And it very much appears that as a country, we weren't very well prepared, not just for the general population, but also specifically for taking care of older adults, knowing full well that the pandemic disproportionately was affecting older adults. So I'm wondering, what else pertaining to sort of the broader issue of aging in America are we not prepared for?
Let me say, too, that the pandemic is disproportionately impacting older adults and people of low income and people of lower education and people who live in highly concentrated communities, urban areas. So that's what we're learning. But let me try to answer your bigger question. Everybody is saying, how could we have not been prepared? We wasted 4 weeks. It's true. China kept the information secret for weeks, and we weren't prepared. Hey, we've had an aging America now that's been obvious for a half a century. We still do not have a cure for Alzheimer's. We still do not have intelligent medical competencies for geriatrics. The number of geriatricians in this country is shrinking, not growing. Last year, 90% of all the doctors and nursing students in America did not take one elective in geriatrics. We have not really crafted almost anything that's going to be needed for the concept of creating healthy, long-lived men and women who will be productive and vital and independent for most of their days. So, yeah, I can, I know George Vradenberg is on this call, who runs Us Against Alzheimer's. And, George goes berserk as he travels around the world, that the world has not yet taken seriously the idea that there are pandemics coming of diabetes, arthritis, cognitive loss, and so on, and we are not prepared for those either. So maybe during this scary COVID time, and the contagion dimension of it is terribly unnerving, that, if you have Alzheimer's, hey, that's your problem. But if you've got COVID, yikes, it could be my problem. So the contagion dimension is really unnerving. But I feel that this is a wake-up call, that there is so much about the aging of our population for which we are not prepared. I'll give you one other two pieces to this. And it's not just in the healthcare field. According to Harvard, only 2% of the housing stock in America is aging friendly. So we have our moms and our dads slipping and falling down steps on throw rugs and bathtubs and bathrooms because the housing industry is not yet awakened, or the aging field is not yet demanded that the housing sector awaken. We have transportation functionalities that are not appropriate for older people. We have too many older people living alone. I think we've gone a little too carried away with independence. Communality might be a better idea. If we had roommates, if we shared a house, if we had a village where everybody looked after each other. So there is much about this age wave for which we are not prepared and need to be.
And I'm wondering, Ken, you were talking a little bit about the history of how ageism evolved. But I'm wondering if we could, for the benefit of some of our listeners and viewers, if we could talk a little bit about sort of how our members or ASA members might best handle these new challenges.
Yeah, and I know you're going to remember something we talked about. Yeah. Wow. It's first of all, my heart goes out and my hat goes off to people working in the aging field who are not sitting in offices but are with elders, that are in services, that are on the front lines. There's been a lot of attention focused on doctors and nurses as heroes, and they are. It's just, I've never seen anything like it in my life. But also those aides staying in people's homes, those caregivers in the communities, folks who are doing Meals on Wheels. There are people in the aging field who are really being saints right now. And so different than the bureaucrats or the, like I am, so many folks in service right now, great respect. And I personally, for example, took offense, I do from time to time, with Joanne Jenkins when she came down hard on the senior living community. Because my feeling was when Cuomo and Newsom and others were talking about protective gear for doctors and nurses, where was the protective gear for these low-paid workers in nursing homes and senior communities? We weren't thinking about them. These people were going back home to their own families and then coming back to toilet our loved ones and to provide them meals. I think we need more regard and respect for people who are on the front lines with our elders. For those of you in the aging field who are not in direct service, this is a time to reimagine a world where more and more of us will live long lives, but they'll need help with purpose. They'll need help with health. And by the way, I'd say not only health after the fact, but maybe we should also think more about how do we buff up all of our immune systems so we're healthier in the first place, preventative health. They're going to need a lot more help with their finances. So I'm not just talking about the segment of the elder population who might be poor or low income. The entire generations of boomers and Xers are going to need a lot of financial guidance and care going forward, or else they're going to fall into a financial sinkhole. So purpose, health, family, community, integration of services. This is a fabulous time to be a creator in the field of aging. There's so much need. And I would also say there's so much fear and there's so much distress and there's so much alcoholism and so much addiction and so much not being able to be with your mom or to be with your spouse when they're ill, that those of us in this field have got to, in a way, be our best selves to help people through this.
And Ken, I suspect, which I'm excited about learning more about, is that your next book, What Retirees Want, A Holistic View of Life's Third Age, is going to get to that point, right? It's really going to get to sort of this positive, empathetic sharing of knowledge, and I'd love to hear more about it.
I'm glad you asked, actually. It's been 10 years since I've done a book. I sort of got weary of book publishing. And so for the last decade, about 70,000 hours have gone into doing research to try to figure out a holistic understanding of what retirees want. And the outcome of it is this book. It's not really, it's actually the book I sort of took a cover and scotch taped it onto another book. And it does come out in July. I've written it with a great man, Bob Morrison. And I do want to say something that you don't know, that nobody knows except my wife. I'm hoping this is my most successful book of all time. It's my 17th. It really is the capstone of all my work. And I want to say that because of all of the help that ASA has given me over the years, and I particularly want to give a shout out to Gloria Cavanaugh, I'm going to donate all of my earnings from this book forever to ASA.
Wow.
So I'm not going to earn anything from it. This is ASA's.
Wow. Thank you very much. Thank you, Ken.
And I can't promise anything, but I have to tell you that I know everybody's thinking these days, oh, what has ASA done for me lately? And it's like, oh, man, over the course of my life, the opportunities that Gloria gave me and people in that organization and nourished me and encouraged me and challenged me. This organization deserves a lot more from us. So I'd like to maybe start that up by saying this book is yours.
Thank you, Ken. Ken, that's amazing. Thank you.
My pleasure. My honor.
So let's get into the book a little bit. I'm curious. Could you give me a little preview?
Yeah, just a little bit. We were troubled by the fact that many people in the aging field knew their silo. Boy, I know caregiving, but I don't know housing. Or I know medicine, but I don't know long-term care. And also people in the leisure industry, boomers in the United States alone are going to have 2.5 trillion hours of free time on their hands. And very seldom at a gerontology meeting are you going to see people from parks and recreation and libraries. And it's not, leisure doesn't just mean, rich people taking cruises. Leisure is what are you going to do with all that free time? And what's going to be the future of media, future of technology? How are we going to deal with death and loss? How are our families going to be nourishing each other? So what Bob and I tried to do in this book is to gather all the pieces of this holistic puzzle and based on current evidence and facts, and then draw in many of the great experts and leaders in the aging field, like Fernando, Karen Jones, who's on the call, and Chip Conley, and all sorts of wonderful people, Paul Irving, different views, Michael Adams, of course. And also for all the people trying to do a better job of understanding the older individual, whether that be in consumer products, food and beverage, air travel, housing, My wife likes to watch HDTV where all they're flipping and renovating homes, and all the couples in those projects are young. But guess what? Half the renovations going on in America are people over 55. How come the world of home repair hasn't really awakened to the age wave? So the attempt was to create an all-in-one place book that was easy to use, made sense of all the pieces of this holistic view, and could be valuable to people in business, government, folks who were trying of all of this. Age Wave decided we might do one more massive survey of how people think and feel about the rest of their lives. And we were scheduled to go to field now, and we did find a wonderful partner for that, the Edward Jones Company. And when this virus was started, we all thought, oh, we can't really do a study now because people are going sort of crazy. And Edward Jones says, you know what, if there was ever a time to really know what was in people's hearts and feelings and minds about health, purpose, and family and housing, the time would be now. So in the next several weeks, we're going to be launching the biggest, deepest survey ever conducted on maturity and retirement, 9,000 Americans and Canadians. And I believe that in September, when we launch the results, there's going to be a special ASA event like this for what does all this mean for the aging services field. So that'll be fun to get those insights from that.
Absolutely, there will be. And, you know, it strikes me that with 17 books, with Age Wave, the success of Age Wave, I suspect you're thinking a little bit about your legacy. What do you hope it'll be in the field of aging?
Oh, wow. You know, my two mentors in the aging field, my two favorites were Bob Butler and Maggie Kuhn, and they were very different, but they both kind of pushed me hard. Maggie pushed me to speak truth to power, and especially in the aging field itself, and Bob was so much of a brilliant, elegant human being. He tried to get me to be a little nicer person than I was inclined to be. Still working on that. I'd like my legacy be that I committed 40, 50, maybe more years to trying to awaken people to the idea that we're entering into a new era. And I think of it a little bit like, I read Michener's Hawaii recently. I reread it. And in the opening chapter, he wrote it in 1959. He talked about these tectonic plates grinding against each other under what we now call Pacific Ocean, and millions of years until they emerged and became Polynesia. For as long as humans have been on this planet, we have been dreaming of the time that we would be living long lives. And what I've tried to do for these 45 years is to shine a lot of lights on that and to try to ask a lot of questions. And so I hope my legacy is that people think I tried my best. A lot of what I've done has failed. I've had a lot of flops, made a lot of friends, made a few enemies. But I guess I like to feel that my legacy in the field is that I was a guy that maybe the Paul Revere of the aging, you know, here they come, here we come. What are we going to do about that? I also want to say that I feel more important than my career legacy is my legacy is the husband to Maddie and a father to Casey and Zach. At the end of the day, especially during this COVID thing, I'm thinking about, okay, what's important? And I'm much more grateful and appreciative of the fact that I found love and family in this life than the fact that I've written 17 books.
You left me speechless there, Ken. I think we can all agree that there are definitely things that, like family and love, that matter now more than ever. I wanted to save just a little bit of time these last 15 minutes for questions from our listeners and viewers, and they seem to be coming in general themes, as you can imagine. Let's start a little bit with some of the COVID-related questions. Ken, what do you think about this public debate now that's going on between opening up, quote unquote, opening up our economy again versus sheltering in place and balancing the public health versus opening up? Give me a sense of what your thoughts on that.
I'm not an epidemiologist, There are epidemiologists on this call, and I take a lot of my cues from Fauci, and I thought Brad Pitt did a great tribute to him on Saturday Night Live this weekend, if anybody missed it. I'm friends with Rich Carmona, the 17th Surgeon General, and I communicate with him regularly. I take a lot of my guidance from him, and I keep an eye on what Bill Gates has to say. So here's my reaction. I think we're an impatient bunch. You know, we've lived through 50 years of pretty well no horrible hardship for most. Yeah, there are segments of our population that have had a rough time, but compared to our parents, their parents, we've had a pretty fluffy time of it. And this is unnerving, and we're unaccustomed to it. And we want it to be over. We want it to be over right now. And I know that. I feel that the same. And but here's what I think. I think we really need to be able to test, not a temperature test, but to see are people positive or negative. Do we have the antibodies that indicate we have it and therefore we might be immune? But then we also need to know if in fact we are immune. I think we need to fast track vaccines. I collaborated on a book when I was 30 with Jonas Salk. And one night over dinner, he told me that how in the 1940s people were so terrified by poliomyelitis, they wouldn't touch strangers. It was contagious. They wouldn't swim in public pools. Don't ever drink in a public fountain, especially if somebody from that other side of town is drunk there. And he says, no, I wasn't trying to build more iron lungs. I was trying to stop the disease. So I really want to put a lot more attention on solvers, not complainers, not debaters, not entertainers, solvers. I do believe that within the next 18 months, maybe as early as 6 months, there will be vaccines available, not just for COVID-19, but for the whole coronavirus spectrum. And so we will have had a problem and solved it. How do I feel about people saying I need to get back to work? I can appreciate it, you know. It's not just about the economy, stock market. It's about people who work in the restaurants. It's about people who teach school. It's about kids who want to get on with their life and play with their friends and ride a bicycle and go to college. So I think that's the tension. But I'm inclined to pay attention to, like I said, Newsom, Carmona, and Gates. But I'll also tell you that I'm really impressed with the way Cuomo and Newsom have been handling themselves in terms of their public messaging, in stark contrast to the bizarre rantings of the person that we unfortunately have as our leader right now. And that's not a Republican or Democratic thing. I think we need to know, like, what's the best play, and are we nimble enough to have it be fact and evidence-based? And I think there's a lot to learn, by the way, from China and Germany, who have done certain things and are a little bit ahead of us on the curve. So yeah, I think the idea of opening, and probably opening for people who have tested as having antibodies and therefore might be somewhat immune, maybe totally immune, would probably be a wise thing to do. But on the other hand, you know, when my wife was pregnant, we sure would have liked to have had Casey be born in a couple of weeks. Would have been more convenient, but it takes 9 months. This thing we might have to get to a level of scientific capability that that requires a little bit more time. We need to be a little more patient, perhaps.
Ken, one of the other sets of questions that are coming up out of this conversation is this idea that businesses have an opportunity here to innovate. And so we're getting a number of questions about business opportunities, and where do you see opportunities for either startups or businesses that are serving older adults that can quickly pivot, perhaps?
Oh, thank you. So there's so much about state of mind here. Is this Humpty Dumpty? Are we all falling apart and hoping we can get back to some semblance of normal, or are we in cocooning? The world has been broken. We are having an opportunity now to think about what we want to put back in, and therefore it's a great hopeful time. I understand there's a scary and deadly disease going on. There are people who are doing nothing but, oh, it's the end of everything we've done and our skills and our talents and our whatever. I'm captivated by, I've got a friend, Richard Haas, who runs the Council on Foreign Relations. And Richard says this is accelerating things, many things that were in motion anyhow. We're heading towards a future where artificial intelligence related businesses and technologies are going to become the norm. Digital health, guess what? Here to stay. For people who are 18 or 20 or 22, there was never a better time to be an entrepreneur, because it's like everything is going to be different. The people who are going to have the hardest time are ones who are like entrenched with I'm used to doing things that way. So in the aging field, man, is there going to be opportunity for transportation, for communal living, for reverse mortgages that they can be afforded. Someone's going to have to figure out how to help people finance their longer lives, because most people don't have the discipline to save and manage it themselves. I think we're going to see enormous eruptions in education. And education, not just learning on the web, but the importance of the socialization of education, not just for young people, but for every stage of life. Why do we think of colleges and universities being only for the young? We should be returning again and again and again throughout our lives, because the skills we might have had are obsolete. So those are just a few. I could go on for 2 hours, but what I'm seeing is sort of the opening of opportunities. There are many calls that I'm on, and I'm on about 7 or 10 webcasts a day now. It's become insane, where some of the calls are people thinking, woe is us, the world as we've known it. And other calls, and they're not capitalistic, greedy people. Other calls, people saying, wow, there's going to be more need for this, and how can we help people with that? And how do we provide, Deepak Chopra is now creating meditations that are customized for you to play for you on your phone. I mean, there are all sorts of imaginative ideas beginning to percolate. And some of them will be goofy, but some of them will probably be the ones we live with in the decades ahead. This is a time for dreaming.
So I've gotten a number of questions related to your ageism conversation earlier, and I think it's a good one to end on. And that has to do with, you started Age Wave, and were very intentional about using the word age in the name of your company. And there have been a number of questions related to language. And, when the headlines all read about older adults and seniors and, we're sort of these ageist principles keep coming out in the media, I'm wondering what your views are on marketing and promoting aging as a positive thing versus a negative thing in this time of COVID, post-COVID. And there have been a number of people who have asked similar kinds of questions.
Again, as I said in the beginning, I don't really know about any of these things, but thank you for allowing me to offer my views, and maybe it'll spark, we've got thousands of people on this call, some other folks who are smarter and better at this than me, but here are my thoughts. When I got into the aging field in 1974, older adults were called golden agers. That was the meme. That was how they were referred to, golden agers. And then this new word, seniors, came along, and it was kind of cool. It was kind of like a new attitude. And seniors, like seniors in high school, or the seniors golf tour. But now we come to think of seniors as what our grandparents were. Every study that everybody's ever done on the boomers said they don't want to be called seniors. They don't ever think they're going to be seniors. That word is gone. And so we have an entire senior living industry and senior services, and senior centers. And I think we're caught in language of yesteryear. I personally, I introduced the word middlescence about 33 years ago, thinking that there was a whole new stage of life emerging between adulthood and one's old age. And I got the idea for that from Bernice Newgarden, a very important player in the aging field who has been almost forgotten. Bernice said we shouldn't be organizing people by their years like the government does. You're 65, you're this. By their functionality, by their lifestyle, by their desires. So middlescence, let's say, goes to about 75. I think at about 75 is what we used to think of as 65 being. And I personally like the word elder. Maggie Kuhn liked the word. She challenged me one night over dinner, come up with a new word for long-term care services using the word elder by the morning, she said. She and I were both speaking at a conference together. Morning, I showed up and I said, elder care. I like it, she said. So I'm hoping that rather than just, and I don't like so much anti-aging and Jack Rowe, he's a brilliant geriatrician, his successful aging. I introduced the word healthy aging in 1990. My wife is working on a book and she's calling it ageless aging. I think it's still up for grabs. I don't think senior is what 65-year-olds think of themselves as being. I'd like to repopulate the word elder as being aspirational. That somebody said to me the other day, oh, since you grew your beard, it's all white. You're looking older. And I said, yeah, on purpose. You know, I'm pretty darn proud of living 70 years and being through what I've been through. So the idea of pride in one's maturity versus trying to have people think you're not old. Yeah, and even with, healthcare, when I introduced the very first presentation in the aging field on wellness and the elderly was Bob Butler, Maggie Kuhn, and myself. And we had people protesting it. They said that it was disrespectful to older people to talk about wellness. That's putting the blame on the victim. And Bob and Maggie and I, we thought, what? So sometimes when you introduce new words or ideas, it makes people uncomfortable. And frankly, I don't think we even need a word for a 70 or 2-year-old. Call them by their name, or call them by, tell them you love them, or say it's nice to meet you. I was on a call a few months ago, and I know we're just at the end, with Frida Lewis Hall, who is a Black African-American woman, medical director at Pfizer, PhD, MD. We were talking about words pertaining to aging. She said, Ken, when I was a girl, I was a colored girl. Then I became a Negro. Then I became an Afro-American. Then I became Black. Now I'm an African-American. I'm still me. The aging field is going to have some time relanguaging and restoring itself. And I think words will emerge. But I do think we need to restory the path from 0 to 100 so that we give weight and respect and power and dignity to the later years of life, not just thinking about them as a time of life where people need to be helped. That too. I'd love to have us imagine a world where our elders were the ones that were the givers and were the shapers and were the seed planters.
Well, Ken, I'm going to end on that optimism that you shared with us. And I want to thank you for joining us. And I want to thank all our viewers and everyone who participated during our first Future Proof. And for the rest of you, please join us on Thursday for another live broadcast with Jeff Klein, who is President and CEO of Nevada Senior Services. And check out our entire schedule and these recorded sessions on asaaging.org. We'll see you again on Future Proof. And Ken, thank you again for joining us.
Thank you, Peter.